And Francesca, the floor is yours.
Thank you. Good afternoon and a warm welcome to this webinar, Stepping Up Efforts Across Europe to Promote and Protect the Mental Health of Long-Term Care Workers and Informal Carers, a Win-Win Strategy. My name is Francesca Centola. I am Policy Officer at Mental Health Europe, and I will be your chair for today. Today is International Day of Care and Support. Earlier this month, we have celebrated the World Mental Health Day, European Cares Day. So today, we would like to shed light on priorities and the concrete action that we all can take to promote mental health in these two targets groups, long-term care workers and informal carers. This webinar takes place in the framework of the Mental Health in All Policy Stakeholders Network, led by Mental Health Europe and hosted on DG Santé Health Policy Platform. By the end of this webinar, it will clear that promoting good mental health for long-term care workers and informal carers is crucial to ensure the fulfillment of key fundamental rights and European values, starting from the right to have accessible, affordable, and good quality long-term care. This is because good quality care is strictly dependent on the well-being of those who provide it, but also because of the gender nature of care, also consideration of gender equality are at stake, as well as the right to health, which includes the right to mental health. And in addition to the human rights argument, it's also clear that it's in the interest of all European countries to support good mental health in long-term care workers and informal cares, because this is instrumental for member states to achieve to address key challenges that they all are facing, such as the sustainability of our long-term care system, the opportunity cost of reliance on informal carers, as well as the cost of increasing mental health problems in our societies. So that's why in the long title, there is a reference to a win-win strategy. We believe it is important to consider all actors in long-term care and emphasize the synergies between long-term care workers and informal carers. And that's why the agenda for today features experts from both the fields. So we will start. Here is the agenda. We will have an opening statement by Mrs. Fag Bufkens, DG Santé. Then we will focus on psychosocial risk and prevention measures for long-term care workers, and this will be done by Unicare Europa. Then we will move to the WellCare project, and we will also broaden up the focus of our webinar to reflect also on what is the impact of informal care on the mental health of these people who provide care outside of a professional framework. And then we will have a colleague from DG Employment referring to occupational safety and health aspects. And most importantly, we will have 30 minutes for discussion with you, the audience. We will hear from Petra, who is a long-term care nurse. She will share our experience, and then the floor will be yours. So it's very important for us to have an active and interactive meeting. And so we warmly encourage you all in the audience to feel free to contribute during every presentation. You can write in the chat any comments or also questions, and then the speakers can decide either they take them by answering in written at the moment, or we take them for the part of interaction with the audience. You can also raise your hands, but then as Clementine was pointing out, you will be part of the recording. So it's very much up to you, but you are strongly encouraged to participate. On a practical note, the presentation will be shared with you, and also the link for recording like a few days after, and a report where we'll be including any resources, any links that will be shared during today webinar. So without further ado, I would like to introduce our first speaker for today, Mrs. Katarzyna Pawlowska from DG Santé, Unit C2, State of Health European Semester Health Technology Assessment. Katarzyna, thank you for accepting the invitation, and I give you the floor.
Thank you very much, Francesca, and I join you in welcoming all the participants of this very interesting and important webinar. I think indeed that caring more for care workers is certainly a win-win strategy. Europe that cares is really at the core of our social model, and the health and care workers are at the core of this model. So we need to talk more, and we need to dedicate more attention to the fact that those who care for others are not immune to illness, are not immune to stress, and can bear heavy consequences of the harsh working conditions. And indeed, data opens our eyes to the very stark reality. We have critical shortages of staff in our health and care systems. Doctors, nurses, carers, they are asked to do more and more with less and less time. So they certainly suffer from the exceptionally high job strain, which leads many to burnout, exhaustion, and even to quit their professions. And we have some really starking figures about the job strain in the, for example, health sector. So what we see on average for all the workers across all the sectors, the job strain is actually the complaint of 30% of them. But when you look at the health sector, you see very clearly that it is very high for nurses. So 61% of nurses suffer from the high job strain, and 43% of doctors suffer from this problem as well. So indeed, we have huge challenges. Our role as the European Commission is to help member states in improving their health and care system. We, of course, cannot step in for them and solve all the issues. This is clearly the national competence. Nevertheless, we try to help them through the actions of the common interest across the EU level. So just to give you a few examples, what we've developed in the health sector. For example, we put in place the Joint Action Heroes, which helps member states to improve the health workforce planning models and to make sure that these models are put to action. This can indeed have an important impact and reduce the pressure on health and care workers through better and recognized health workforce planning. Another example of the action, which is quite new, is the action focused on the retention of nurses. Nurses are our precious resource for both health and care systems. And this action, which has just been kicked off, will help member states to build stronger policies to retain nurses at their job places, but also to attract young people to the nursing profession. Because unfortunately, what we see in recent trends is that the interest of young people in health and care professions is decreasing. So we have to help member states to reverse this trend. We also have some actions focused on skills. These are very important as well. We have to make a more optimal use of skills in our health and care systems. We have to try the new ways, the innovations in how health and care is provided, building more cross-sectorial collaboration and ensuring that we provide care in teams, that everybody who can contribute actually feels the ownership for health and care models. So this is at the core of our attention in the actions on skills, because we also have to admit that we cannot just increase the size of health and care workforce. We have to try and test the new solutions. I would also like to say a few words about the EU approach to mental health. As you all know, last year we put in place the first comprehensive approach to mental health. This is the policy with 20 flagship initiatives and quite a sizable budget of 1.23 billion, providing quite some opportunities to member states to improve access to mental care. But there are also some initiatives which focus on mental conditions and mental health of health and care workers. And I would like to flag one important development. To mark the World Mental Health Day on the 10th of October, the Commission released an updated tracking framework that helps monitoring the implementation of these 20 flagships initiatives. And just allow me to name a few of them, which I think are interesting for the debate today. One of them is the EU Promise. So the Commission is supporting through this initiative member states to ensure that they develop the comprehensive training program for health professionals, social workers, educators, and other professionals working in community settings. The aim of this action is to enhance the skills and knowledge of those professionals to support a truly comprehensive approach to mental health. We work very closely with the WHO office on another flagship initiative. This initiative is called the European Mental Health Capacity Building Initiative, and as its name suggests, the EU the Commission and the WHO try to support member states in providing support to the policy dialogues and capacity training to ensure that we step up the efforts and improve access to care. Last year, within this initiative, the Commission and the WHO launched a survey, which actually gave us the overview of challenges related to policies, legislations, and other barriers and obstacles in access to mental care. And on this basis, indeed, we step into the efforts to develop the policy dialogues and capacity training for member states. And let me also mention a new development, which is a survey, which was just launched last week. And this survey will identify the mental health issues for the health workers across 29 countries. And the webinar which took place last year indeed highlighted the role of the survey in improving the evidence on challenges we see in the sector and on feeding into the policies and improved approaches later on. I am really very glad to be here with you to listen to you, and yeah, I wish you a very successful debate. Thank you.
Thank you so much, Katarzyna, for highlighting the challenges of the health and care workforce, but also for shedding light on the concrete actions that are carried out by the European Union to support member states' efforts. The aim today is indeed to reflect on the challenges, but also to be solution oriented. So it's great to see what is happening and what we can do to support these two target groups. So thank you so much for your input, and I will now give the floor to Mark Berpel from Uniglobal Union Unicare Europa. Mark will be focusing on psychosocial risk for long-term care workers, focusing on the sources, but also again on prevention measures. So thank you, and the floor is yours.
Thank you very much, Francesca, and also thank you to DJ Sante and Katarzyna for the opening remarks. It's very good to be here with you today, and I'm very grateful that we can take the opportunity on the International Day of Care and Support to have such an important meeting and discuss workforce issues amongst long-term care workers. So what I'll try to do within my 15 minutes is to talk about some of the factors leading to psychosocial risks, some of the sources, and also what trade unions and social partners can do in order to prevent and also mitigate and also address some of the mental health and psychosocial risk issues. So to begin with, I just think it's important to draw some kind of macro level kind of trends that are occurring and that have profound impact on workers' mental health and psychosocial risk. One of them we know perfectly fine is that within the care sector, there's been an increasing focus on person-centered care. And this person-centered care has been driven by patient groups, by care users groups, by families, by persons with disabilities. And effectively, trade unions don't mind such an agenda if it also includes, the workers that are providing these services. Because I think that what some of it has led to is within the European member states, this has led to a deinstitutionalization of care, which means that we now have care in the community. We have more focus on home care solutions. We have focus on workers working individually rather than in teams in an institutional setting. And so a lot of the collegiality that care workers have experienced in the past has been eroded. And this is a consequence of, further down the line of this focus on person-centered care and care in the community. And I think what policymakers need to pay attention to is that those social links that have existed previously amongst care workers in an institutional settings are also introduced into a community or home care setting. That can be through training, through check-ins, through other measures, but as well as, I'll come back to that later, what kind of the role that unions play within forming collegiality and building community. So I think that sectoral trend is really one of the things that we need to pay attention to because it changes the nature of the work from one working in teams to one of individuals working for themselves, causing further individualization. I think the second macro trend that we have witnessed in the last few years, and we can't just put it aside as much as we would like to, is the COVID-19 crisis. Because the COVID-19 crisis was, effectively revealed all the cracks and all the flaws that exist within our care systems, the understaffing, the fact that care work has been undervalued, etc. And I think that what we have seen in the past is that during the COVID-19 crisis, these workers were labeled essential workers. These labels were labeled system relevant workers or key workers. But labeling these workers in such an essential way, making them work throughout the pandemic, in which they had to often isolate from their relatives and loved ones in order to not become vectors of the further transmission of COVID-19, also meant that they made an immense sacrifice. And what we see after that is that the quit rates amongst long-term care workers have actually accelerated. And so one of the issues being is that for policymakers in particular, that if you label or if you give a legal status to workers of being essential workers, then it also has to go hand in hand with a different level of recognition or status inside of the labor market, because if the two things don't align, you're effectively undermining person's self-value on the one hand, and I think that has tremendous psychosocial implications for workers. And I think the last macro kind of trend, the labor shortages is within the sector, are a contributing factor, not only at that macro level, but have a concrete, find their concrete expression in the workplace. And what do I mean by that? We see that labor shortages, and we often mention figures of 160,000 care workers missing in Germany, or we mention, X hundred of thousands missing in France, etc. But effectively, it means that at the workplace level, the existing workforce is understaffed. And this understaffing leads to care workers doing more work with less time. It means that they often rush from one patient or one care user to another. It means that ultimately they don't have the break times that they would require in order to also wind down, or cannot take their holidays because they know that they would leave their care users, they would leave them alone without sufficient help. And I think that this situation really, and we have evidence, and we've created through the EU-funded Retain project that we ran between 2020 and 2022, and then it has been cited by the OECD and the ILO, amongst others. We have shown what kind of a tremendous impact those labor shortages have on workplace relations. It increases the competition at the same time between workers as well, and it undermines collegialism. And we know that this is one of the main sources of psychosocial social problems that long-term care workers have, because it means that every day workers come to work and they know that they will be completely overburdened. And I think all of us office workers know what it's like when you come back from holidays and you have 500 unread emails, and what it does to our mental health and how we think that we're swimming. But imagine, being the only person at night with 12 to 20 people on one floor in a long-term care home, and only being a care assistant. I think we can't even comprehend what that does to us. And I think that leads us to following. Most care workers join the occupation because they believe that it's their calling. They believe that it's an occupation. They want to care for people. And the current working conditions make it impossible to fulfill that vocation or to fill that calling. So there's a disjuncture in people's heads between what they're able to do and what they would like to do, causing immense stress amongst the workforce, causing for competition, as I said. The shift to home care is causing isolation. And in situations in which people are stressed, people are overworked, etc., both from the care user as well as from the care worker itself, violence and harassment start to take foot. And this is a very dangerous situation. We've seen throughout the pandemic, we've seen various scandals be exposed in the for-profit as well as in the not-for-profit, and as well as in the public part of the care sectors. But we have figures from Eurofound which also expand on that, saying how much violence and harassment care workers are subject to, and it's that effectively which is the real pandemic that we face today. Just in order, because I know that time is of the essence, to keep this webinar short and brief, and that everyone gets equal amount of say, what we're trying to say as unions in the care sector is really that patients and care users' human rights are bound to the working conditions and are bound up with workers' rights within the sector. You can't have quality care, you can't have person-centered care without treating the workers as persons as well. They're not just simply another input into the care sector, but they're what makes the care sector work. And so we need to pay particular attention to some of the very human nature of care work itself. Care workers are confronted with death in many cases, and oftentimes there are no provisions in place for care workers to take time for respite after one of the care users they have cared for has passed away. This is something that really needs to be addressed. We also know that within a day, everyone wants to wake up at the same time around 8 o'clock. Everyone wants to, go to bed around the same time at 9 p.m. And so you have these peaks where the understaffing, the labor shortages are really concentrated, and and then you still have these out of bounds events, accidents, trips, falls, etc., which put a strain throughout the day onto the care worker. So how do we tackle all of these issues? I think it's very good to see that DG Sante is putting an emphasis on care workers' mental health, particularly because we know that it's not only the fact that, like, how do I explain it? So you have a kind of reinforcement between like musculoskeletal diseases, stress, etc., and like bodily symptoms and psychosocial risks. So it's not only the case that people who have mental health issues due to their work, it expresses itself in depression or in other clinical, but it also expresses itself in bodily pain, which makes workers it makes it impossible to work if you have a hernia in your back, or if you have other musculoskeletal diseases, which might be a symptom of the high levels of stress that you face. So for that reason, on the International Day of Care and Support, we need care. We're calling to really tackle undeclared work within the sector, because there's a lot of undeclared work that continues to happen, as well as like a formalization of all those workers who are currently working in the home-based setting. This is really important, that care work that is taking place within the home is recognized as work, and that the same kind of health and safety assessments, etc., are made when a care worker works in someone's homes. We're talking, and we've also done that at the ILC earlier this year at the International Labour Organization, are talking about staffing ratios. In order to ensure a person-centered care system, we need to talk about staffing ratios in institutional care settings, because this is one of the most effective preventive mechanisms in order to ensure that workers have a sustainable career inside of the sector and don't just leave the sector and end up stacking shelves at Amazon because it's paid better and involves less stress. And then ultimately, we're also calling for an end of violence and harassment, and putting in place, and for employers to put in place measures in order to tackle that pandemic. And last but not least, I wouldn't be a good trade unionist if I didn't say it. We really need to focus on turning care jobs, the jobs of the future, the jobs that everyone hails are the new green jobs, into good union jobs that can feed families and that can ensure that women can live off of these jobs. At the moment, the grand majority of workers, and these are also Eurofound's statistics, are actually fall below the threshold of what constitutes an adequate minimum wage. In order to tackle the kind of, just in terms of like the cost of living crisis, to tackle the fact that some of these women are the sole bread earner or of their families, we need to make sure that that the wages that they earn suffice, and that they can live a dignified life off of that. And ultimately, I also think that in these times in which we see a crisis of isolation, like people are spending less and less time with their friends, less and less time with their family structures are thinning out, people no longer go to church, mosque, or synagogue, etc. Work is one of the places in which everyone still goes to, or a lot of society goes to, but we also need to make sure that there is a sense of community, a sense of collegialism, and the best way to ensure that is through trade unions. That's how the original guilds started to form, in order to set a level of community around professionalism, around certain standards. And I think it's an idea we need to get back to today, and that is ensured through collective bargaining. As old as that idea might be, it's still the way to ensure that workers within this sector will, have a level of pride, can ensure that to feed their families, and can also build that sense of community at the workplace. And we as UniCare are trying our best to do that through various projects. And we hope that you like our contribution, and I can put a few links into the chat so that we can continue the discussion over the coming months and years of this legislative period. Thank you.
Thank you so much, in particular for putting on the table the issue of what is care work and the human nature of care work. This fact that care is not just a job as others, but it's a vocation, but also the importance of have these links with other human beings, and the relevance of human rights in everything we are trying to achieve today and in our daily job. So thank you so much for this comprehensive overview. Please do share the links in the chat for our colleagues, and if not, they will also be put in the report. And the audience, please don't hesitate to put comments or questions already in the chat. And now I have the pleasure to give the floor to Professor Elisabeth Henson. Elisabeth is professor at Linnaeus University in Sweden. She's the principal investigator of the WellCare project that she will present in a second. And she's also advisor to the board of Eurocarers, the European network representing informal carers. And here we will hear more about these projects and how we can engage with it, but also as so far we have mainly talked about long-term care workers. I believe she will also put the focus of the presentation on informal carers and what is the impact on their mental health related to caring responsibilities. So Elisabeth, thank you so much for being here today with us. And the floor is yours.
Thank you very much indeed, Francesca, and it's indeed a pleasure to be here this afternoon. So the focus of my presentation is all about transforming care and empowering lives. And as Francesca has just very kindly explained, I shall be providing you with an overview of our current Horizon Europe WellCare project, and also focusing in particular on the situation and supports for informal carers. I'm just going to see if I can just click on my next slide. I'm just, yes.
Normally it should be working. Try again.
Thank you. Oh.
Yeah,
yes,
it's working.
Yes, it is working. I can only just see half my screen. That's lovely. Okay, I'm ready to roll. So The focus within our WellCare project is two target groups. Firstly, informal carers, who are mainly people who are providing usually unpaid care, often on a regular basis, to someone with a chronic illness, disability, or other long-lasting health and or care need outside a professional or formal framework. And as you've just heard very eloquently from Mark just now, long-term care workers are consisting of mainly qualified registered nurses, in some countries assistant nurses, together with personal care workers that are either employed by long-term care providers in the home or residential settings, or directly by the care recipient or family. Within our WellCare project, we have a close partnership. It involves partnerships between our 6 research organisations. 5 of those are within 5 EU member states, carrying out research in the area of care and caring. And they are twinned very closely with 5 national member states advocacy organisations working in the field of informal care. And then at EU level, we have a close collaboration with several EU level advocacy organisations. Eurocarers, representing informal carers and informal care, and the European Ageing Network, representing aged long-term care, the European Association for Service Providers for People Living with Disabilities, representing disability-related long-term care. And in the centre, we have our EU-level advocacy organisation, Mental Health Europe, which is the core focus of our project on mental health and resilience. So let's take a look then at what are the key issues at stake. Informal carers, those in particular who are providing high intensity levels of caring over a prolonged period of time, are at significant risk of experiencing a triple penalty. You may wonder, well, what does that mean? Primarily, it's all about a negative impact on both their physical and mental health and well-being, an impact on their financial situation, for example, carers of working age often having to reduce their paid working hours to care for a family member or friend, and also in terms of their social situation, becoming quite easily socially isolated and excluded. Informal carers make up at least 52 million adults in the European Union. But also you've just heard from Mark a moment or two ago about the 6.3 million workers in the long-term care sector who also, similarly to informal carers, are experiencing a range of significant risks to both their mental and physical health. So both, we can see, face the potential risk of compromising their mental health over time. And I think it's true to say that so far they've mainly been tended to be viewed as two almost separate groups with differing needs and situations, rather than being seen as being interconnected, where the well-being of one influences the well-being of another. So this is a primary area of interest of our WellCare project. But I'd just like to delve into a bit more detail about the mental health of informal carers. We can see from the research that anxiety and depression are generally at least 20% higher among informal carers than the general population. And those providing high intensity care are more likely to experience mental health problems. And as we've heard loud and clear about gender equalities, here in informal care we can see that women often engage more often engage, and to a higher extent engage in high intensity care. They carry out more demanding types of care, such as personal care, responsibilities for coordinating the care, and as a result experience much poorer subjective mental health. In addition to the risk factor of the higher intensity caring, there are a number of other risk factors that can compound. For instance, the illness or disability of the care recipient. We can see, for example, for carers caring for people with cognitive difficulties, such as people living with dementia, though carers experience at least a third of all carers of people with dementia are suffering from clinical depression. But also carers' existing health status themselves plays a role, particularly where they also themselves may experience long-standing chronic conditions, particularly amongst older carers, for example. Also for a carer who has no prior experience of caring, and neither do they have had access to skills training, this can also impact negatively on their mental health. Also, where informal carers are caring in complete isolation on their own, they lack support from other family and friends, but equally from the formal long-term care workers. And also where carers are experiencing a complete lack of satisfaction in their caring situation, where caring may not primarily be a choice, but they feel they have no choice but to care. All of these factors can compound to create a chronic stress experience. So you may be wondering, what can we do to help promote and maintain the mental health of informal carers? Well, we can do an awful lot of things. All of us have a role to play. We can work at mitigation measures to try and support informal carers in their caring situation, to try and increase their mental health and resilience. For example, research shows that what we call multi-component support groups have an effect on a positive effect on their mental health. This means providing tailored information and education with regards to their caring situation, providing information about the illness or disability of the person they're caring for, information about the range of supports that are available to them, as well as the possibility to actually practice various skills, particularly, for example, to broaden their coping repertoire, their coping strategies, for instance, and also, very importantly, to have peer support, to be able to talk and share openly and have emotional support from others in a similar situation to their own. And particularly important for those high-intensity carers to have a regular quality break from caring or respite care. These are just some of the mitigation measures. But of course, we need to be able to tackle the issue at source via a comprehensive preventive approach. So we need to be working, as you heard from Mark a moment ago, at all levels, macro, meso and micro. But at macro level, to try and ensure access to affordable and quality formal long-term care so that informal care does remain a choice. Also, for those carers of working age, which represent the highest number of carers, type of carers within the European Union, to be able to ensure a good work-life care balance, so that they're able to continue on the labour market and aren't feeling obligated to reduce their working hours or leave the marketplace altogether, and whereby that triple penalty comes in and may lead to poverty. Also, on a wider level, to be able to ensure carer-friendly societies, where carers are recognised and identified and valued for the care that they provide. Equally, as you heard from Mark a moment or two ago, both the formal long-term care workforce, but also informal carers. Very important. So all of these factors to ensure that informal caring is indeed a choice. Let's go on then to focus on the WellCare project. Our overall goal is to try and strengthen supports available to both informal carers and long-term care workers for improving their resilience and mental well-being through what we call care partnerships, which I'll come back to in a moment. So we're working to try and improve working and caring conditions so both target groups will feel well, be well, and also in turn be able to care better. And our approach, as you've heard from me from my partnership slide, is very much about research and advocacy working together to co-create research to be able to impact on policy at member state and EU level. We have a number of core concepts within our project, the first one of which is user and stakeholder involvement. And we actively involve both informal carers and their organisations, frontline long-term care workers, together with care managers, decision makers, employers, representatives from trade unions, professionals associations, representatives from wider civil society, policymakers in each of our 5 partner countries through a method that we've been working with in Sweden called blended learning networks, which are basically heterogeneous communities of practice where these users and stakeholders come together on a regular basis and they learn and share experiences with each other about the core project topics, and they provide invaluable advice to us, the researchers within the project. Of course, resilience is a core concept within our project, building on the work of Mental Health Europe, and also listening very carefully to members of our blended learning networks. They were very keen to emphasise that resilience doesn't only lie with the individual, it very much is part of a community resilience. So the ways in which we're able to explore the social environments and the availability of resources with them. So we're very concerned about broader systemic factors, as well as psychological and social factors. And as you've heard from me a moment ago, we're very interested in care partnerships. Directly building on the EU care strategy, we're focusing on the coordination, integration, and mutual recognition of care and caring activities that are carried out by both long-term care workers and informal carers, working towards a vision of integrated long-term care. So you may be wondering, what have we been doing then since the start of our project in January this year? And I should say that we are a 4-year project. Well, led by the National Institute of Health and Science and Ageing in Italy, or IRCA for short, together with our country partners, we've been carrying out quite a comprehensive and systematic literature review, both of the scientific literature and the grey literature, to identify a number of good practices which have the aim of reducing risks for both occupational and non-occupational challenges. Based on those, we're then in the next phase going to be developing a number of what we call innovative solutions, and then implementing and testing them in each of our 5 partner countries of Germany, Italy, the Netherlands, Slovenia, and Sweden. And continuously through the project and led by Mental Health Europe, we are also analysing policies at both member state level and at EU level, and also bringing in relevant ongoing research findings from our project, which together we combine to produce action-oriented recommendations for stakeholders at both member state level and EU level. And as you've heard from me a moment ago, via us setting up blended learning networks in each of our 5 countries, in this way we're trying to establish and maintain a sustainable research, innovation and sharing process involving our 2 core target groups and all key stakeholder groups. And I'm also very excited to say that our first project policy report is now available. It's being officially launched at our webinar here this afternoon. It's been led by Mental Health Europe in close collaboration with all our partners. It's an analysis of legislation, policies, care frameworks and funding schemes, and it answers the question of how these policies then impact on the mental health of informal carers and long-term care workers. We have country snapshots for each of our 5 partner countries, and we also explore the question of what's the current EU policy climate, so that we're able to be highly aware of the entry points that we can make with our research results as they become available. And here we're particularly drawing on the EU care strategy, but also the comprehensive mental health framework. We're asking the question of what can policymakers at EU and member state level do to better support long-term care workers and informal carers. And we address the crucial question of why should we care about carers? So if you'd like to know the answers to those questions, please do access our report here. You'll see the address. And here you can see our core partners in the project. I think because of the time factor, I'm going to skip over that and go to my final contact slide, where I'd like to ask you to do follow us on LinkedIn. You're welcome to subscribe to our project newsletter. We have the first one hot off the presses. You can see here the link to our dedicated WellCare project website. And also, I'd like to urge you that if you have good practices to share with us, if you'd like to share your knowledge and experiences in this very important area, then please don't hesitate to get in touch. So many thanks for your attention.
Thank you so much, Elizabeth, for this comprehensive presentation, for shedding light on the mental health of informal carers, and also stressing the importance to work with care partnership. And so don't consider long-term care workers and informal carers as two separate groups, but to focus on the interconnection and the partnership between them, and also the importance to give care the value it deserves. I think that's why we are all together today to discuss what we each of us can do to give care the value it deserves in our societies, in our political agenda. So thank you so much, and I echo what Elizabeth was suggesting. So please go on the website, have a look at what is already available and next steps, and by all means, if you have expertise that you want to contribute to the next project activities, don't hesitate to get in contact with Elizabeth or us, Mental Health Europe. So really, together we are stronger, we used to say. So thank you again. And now I would like to go to another representative from the European Commission, this time from DG EMPL Health and Safety Unit, and it's Mr. Francisco Jesus Alvarez Hidalgo. Thank you for being here, and the floor is yours.
Thank you, Francesca. Good afternoon, everyone. Many thanks for having invited us to attend this very interesting meeting. And I will mainly focus on the occupational safety and health aspects of this important matter. We appreciate a lot the opportunity of talking with you in this International Day of Care and Support. And we would like first to make clear that the protection of workers' health and safety has been high on the Commission's agenda in the past years. But we have all to recognize that the pandemic crisis, as Mark already mentioned, has shaken the whole world of work, and clearly brought OSH, occupational safety and health, to the spotlight and showed to the whole society the importance of health and safety at work in the daily life of the EU citizens, and the importance of keeping the society and the essential work and the essential services working in times of crisis. No, it is obvious, and I will try not to repeat what has already been said, that certain group of workers, such as those working in long-term care, can be more exposed to mental health problems at work, as we all know. And in this respect, I would like to share with you the fact that the Commission adopted 3 years ago already, a communication on the EU strategic framework on health and safety at work for the period 21-27, which sets out the key principles and actions necessary for improving workers' health and safety. The overall objective of this communication is to make the workplace fit for the increasingly rapid changes in the world of work due to, among other elements, digital and green transitions, the pandemic crisis again, and the climate change. No? This strategic framework has a particular focus on addressing psychosocial risks at work, and it indicated a number of actions foreseen in the area of mental health at work and psychosocial risks, such as the review of some directives, in particular the review of the workplaces and the display screen equipment directives, as well as the announcement of an OSH summit, of stock-taking summit that took place in May last year, 2023, co-organized by the Swedish presidency and the European Commission. In this context, this OSH summit in Stockholm addressed several topics, including mental health at work, and the conclusions of this summit confirmed that significant progress has been made in the implementation of the strategic framework, with actions being implemented at good pace. But the summit also identified a number of remaining challenges, in particular the ongoing growing occupational safety and health issues that need intensified further consideration, for instance, such as psychosocial risks and mental health at work, among others. This OSH summit also reconfirmed that the framework directive, which is the cornerstone of the EU OSH acquis in this policy field, with this prevention approach, is a golden standard to workers' protection, because the employer has the duty to ensure the safety and health of workers in every aspect related to the work, including when it comes to psychosocial risk. However, it's necessary to highlight that more efforts are necessary to fully and effectively apply the legislative provisions, as well as of those related directives on the ground. No? I would like also to briefly refer to the Commission communication on a comprehensive approach to mental health. Katarzyna also mentioned that it was adopted in 2023. But I would like to highlight a few elements. For instance, the fact that this communication has a chapter dedicated to psychosocial risks at work, which indicates, among others, that the Commission will follow up on the conclusions of the OSH summit that I mentioned to improve mental health at work in full respect of tripartism. And also that the Commission will continue to work in the review of the relevant directives. Katarzyna mentioned 20 flagships, effectively, but 2 of them, I would point out that 2 of them refers to aspects related to health and safety at work. In particular, the campaign, the Pan-European Healthy Workplaces campaign that EU OSHA, the European Agency for Safety and Health at Work, is carrying out right now on digitalization in the period 23-25. And the next one, the next campaign that will take place on 26-28, specifically on mental health at work. The second flagship that was mentioned in this communication is that the Commission is going to conduct a peer review on legislative and enforcement approaches to address psychosocial risk at work in the member states. And actually, this peer review took place recently in June in Brussels, hosted by the Belgian presidency, with the participation of several member states, as well, of course, as representatives of social partners and the European Agency for Safety and Health at Work, EUOSHA. I will also underline the fact that very recently in the political guidelines, President-elected von der Leyen committed to stepping up our work on preventive health, in particular for mental health, including at work, literally. This commitment to address mental health at work was reconfirmed in President-elected mission letter to the Executive Vice President designate for People, Skills and Preparedness, Mrs. Rosanna Minchatu, requiring work on improving Europe's approach to occupational health and safety, ensuring healthier workplaces and mental health at work. I will finish by briefly mention, all of you probably know the European Care Strategy that was adopted by the Commission in 2022 with the objective to ensure qualified, affordable and accessible care services across the EU, and also to improve the situation for both care receivers and the people caring for them, professionally or informally. And this important care strategy specifically addresses the need of having high quality, affordable and accessible care services with better working conditions and work-life balance for carers. In particular, there is a chapter dedicated to fair working conditions and training for care staff. And in this context, to improve working conditions and attract more people, in particular men, to the care sector, member states are recommended to promote collective bargaining and social dialogue with a view to improving wages and working conditions, also to ensure the highest standards of occupational health and safety in these activities, to design continuous education and training for care workers, to tackle gender stereotypes around care and launch communication campaigns, and also to ratify and implement the ILO Convention 189 on domestic workers. I think I will stop here to respect the timing. I'm happy to comment and to reply to any point or any question. Thank you very much.
Thank you so much, Francisco Jesus, for this input, in particular for also referring to the policy developments, the promise from von der Leyen to step up efforts in relation to preventive, in particular in relation to mental health, and also this need to continue to focus on the topic of mental health at work and what the European role can be in that, as well as the reference to the need to do also campaigns against this idea of care as a female-only destiny, and so the idea of challenging the gender stereotypes. This is an important part also that needs to be acknowledged. And so thank you so much for highlighting all the things that are already taking place. I see that in the chat we start having some questions, so please keep them, keep writing them, and then we will answer during the upcoming session. And should we not be able to address all the questions during the webinar, we will publish the response online in the report that we will disseminate afterwards. So feel free to send as many questions as you like. And now, thank you to all the speakers so far. This is the part of interaction with you, dear members of the audience. To break the ice, I would like to start by giving the floor to Petra Vendrik. Petra is a registered long-term care nurse from the Netherlands, member of the CNV, and I believe she will be sharing her experience as a nurse, but also shedding light on promising practices from her country, the Netherlands. So Petra, please, the floor is yours.
Try, you need to unmute yourself.
Yes. Okay. Thank you, Francesca. Thank you. Good afternoon. Yes, I'm very happy to be able to speak today, combining my experiences as a registered nurse and my work as a policy advisor at CNV. I have gained deep insights into the challenges faced by healthcare professionals, and today I would like to discuss the significance of professional autonomy and decision-making authority as a crucial factor in preventing mental health issues for healthcare professionals, while it also plays a vital role in addressing the current challenges faced in healthcare and social services. The mental health of healthcare workers in the Netherlands is under pressure. The care gap is widening. And despite current and planned measures, the prediction is that the labor market shortage will rise from 50,000 this year to about 232,000 people by 2033. To tackle this growing shortage, we need to think differently and to do more work with fewer people. And while the majority of individuals still find the work in healthcare and welfare meaningful, it is essential to consider how to stay healthy and sustain one's well-being, and even better, maintain job satisfaction under these circumstances. As Katarzyna and Mark already introduced, the job strain in healthcare is not expected to decrease. Instead, we know it will rise. To effectively manage these growing demands, healthcare professionals need robust resources. Professional autonomy and decision-making authority are essential resources that play a key role in supporting the mental well-being of healthcare professionals. It impacts their well-being, leading to higher job satisfaction, lower turnover rates, and improved patient outcomes. When organizations prioritize professional autonomy in decision-making, they create an environment where healthcare workers feel more empowered to face day-to-day challenges, and they feel more valued and engaged. And as such, empowerment is also a crucial tool for achieving labor market goals such as sustaining high quality of care and retaining staff. In the recent years, the Dutch government has focused on enhancing the empowerment of caregivers and nurses. In 2022, the action program aims to sustainably strengthen the professional autonomy and decision-making of the healthcare workforce through an integrated approach that includes practical initiatives, research, and monitoring. It is a nationally supervised subsidy program designed to strengthen the empowerment of the healthcare professionals. It is for the professionals, so they only can apply for a subsidy. It is a collaborative effort involving various professional organizations and sector associations. And the key activities include developing action plans, networking, offering tools and resources, and stimulating a national movement to reinforce empowerment across the healthcare, youth care, and social work sectors. But it isn't just an argument for a profession to express its voice. To truly make an impact, that voice must be heard. And that's where supervisors, healthcare organizations, policymakers, and governments play a crucial role. Their engagement is essential in ensuring that professional input is not only considered but acted upon. And by empowering professionals in this way, we create a workplace where healthcare professionals can thrive in a supportive and healthy environment. And by working together, we can pave the way for a more empowered workforce and ultimately safeguard the well-being of those who care for others. Thank you for your attention, and I look forward to any questions you may have. And if anyone would like to know more about the subjects, please feel free to contact me.
Thank you so much, Petra, for sharing these insights with all of us. I invite you all to either raise your hands or write the questions in the chat. I see that there are already a few questions. I will read them out. There is one question. I will be interested in hearing more from the panelists on the current challenges of migrant workers in the care sector and approaches to meet those challenges. Thank you for raising these very important questions. I don't know who among the panelists wants to take this, maybe Mark, or I leave to you.
I can say something on migrant care workers. I think the first thing to bear in mind is that a lot of migrant care workers end up working in situations or are being paid less than their counterparts. I just had from the German Research Institute, IZA. There was a study, and it showed very clearly that there's a pay gap between migrant care workers and both like care assistants as well as qualified care workers. So I think it exacerbates the issues that we have mentioned before. The other thing is to say is that lots of migrant care workers are centered then in long-term care facilities like or even work in live-in care arrangements in which the isolation element that I mentioned previously is of course then exacerbated as well. So I think if you then of course look at if you look at migrant care workers then coming from third countries such as the Philippines or Vietnam or or other countries across the world, you will of course then have issues that are related to psychosocial issues or mental health issues that are also due to migration, but which are not like care specific ones, right? Like, does the person have a support network, within a company or within their workplace, or what kind of other issues emerge through the process of migration? I think it's an important question to ask ourselves, because I think that we know that mental health support in care workplaces isn't necessarily given because lots of, and Jesus was speaking about it, lots of the framework directive, right, comes out of coal and mining and applies to workplaces which are larger than care workplaces. If you fall below a certain threshold, you're not legally obligated to provide certain like structures that like big companies, big kind of male dominated industries need to follow. And so I think that it's precisely like those workers that enter the care system like from like through migration that they like are most likely also to fall between the gaps. So as part of my dissertation nearly 10 years ago now, I interviewed a bunch of like young Spanish migrant care workers who had been trained as nurses in Spain and who ended up working as care assistants in Germany. And the one thing that always came up is like isolation is like the big thing. It's the second thing is like they thought they were also letting their families down by working in in unworthy working conditions because they had like been trained at universities to be nurses and ended up working below their qualification level. And they said, this is nothing to be proud of. And also the fact was that because even in the European Union, we always think of standardization, harmonization, etc. In healthcare and care, it's anything but. And so they had been trained and they were in Spain. These were qualified workers who were able to give shots, able to do be part of like medical procedures. And in Germany, this was of course not the case. And so they thought they weren't able to do the tasks which actually patients needed, but there was no one to do them there. And it just drove them completely crazy, creating a kind of vicious cycle in which they would, after a couple of months or after a year, they would try to immediately leave Germany again and return back to Spain. So like migration, I know we have EU talent pool and all of that. It's a quick fix for the labor shortages. Like we need sustainable solutions, and sustainable solutions don't come easily, and they don't come in cost-effective natures oftentimes. Yeah, like it requires like investment and investment also into people's mental health and support systems.
Thank you so much for this comprehensive reply. We have another question, I believe, for the panelists from the institution. And the question is whether European programs to promote and protect the mental health for long-term care workers concern only member states, or if they may also concern other organizations such as hospitals directly. So I leave this to between Katarzyna and Francisco Jesus, if you may answer.
Yes, sure.
Thanks.
Yeah, sure. So what I mentioned in my intervention was the survey that has just been launched, and it is led by the WHO office in Copenhagen. And the idea of the survey is indeed to follow up with some kind of policy feedback. So we want to create a certain framework with guidelines for member states on what should be done. And I would like to, so it would be, of course, something very transversal, because what our experience showed, we had a cluster of 5 projects supported under the third health program, which has just concluded in June and July. And one of these projects, the so-called Meteor, was indeed dedicated to the issues of retention of health workers in their workplaces. And under this project, there was a big survey which was delivered, and this survey focused indeed on workers of hospitals. And what were the main conclusions? It was, first of all, very difficult to get health workers from hospitals engaged in the survey because of lack of time, because of the pressure they experience. But the project coordinator did a very good job and still provided us some critical findings of this research. And what did the research shows that to address the mental care and issues and all the challenges related to stress at work and all the factors which finally lead health workers to quit their workplace or to even quit their profession, we need policies at cross-sectorial level. So we need to work to improve the health and safety standards. So this is what my colleague addressed in his intervention. We need to have more solid legislative frameworks and policy measures to ensure that they work better, that they protect health workers from the heavy work burden, from heavy stress at work. So we need to have in place the more systemic solutions, but we also need to work to improve the workplaces as such. And this is the responsibility of the managers of the care settings, so of the hospitals as well. And to do that, there is a need for various measures. You need to, for example, our project show it, you need to, for example, ensure access to kind of mental support, especially for the young health workers. They need to feel supported. They cannot just be integrated in the hospital setting, which is completely new to them, and be left alone. They need to be integrated. They need to be accompanied in the understanding of what it means to be a health professional in the hospital, which is overburdened, in the hospital which, as Mark mentioned, sees death every day. And this is, this will not be, this is not an automatic process. These young health workers need to be accompanied. You also need the peer support for any issues you have, for any kind of tensions at work you have. So I think that this is a very, this problem requires really very wide-reaching approaches and at different levels. So we cannot just solve it through the legislation. I agree with Mark that maybe some of the problems we see just fall through the cracks. Yes, maybe that could be indeed a problem. That's why I think we need to work at many levels. And Francesco mentioned that what is becoming also more prominent at the EU level is a stronger collaboration with social partners. So you might have heard about the action plan on labor and skills shortages, which was issued this year following the summit with social partners. And this is exactly the best example of the approach we need. We need to work at various levels. This is not up to the Commission or up just to the hospital director to solve all the issues we have. We need to really contribute at all the levels and build something comprehensive which works for health and care workers.
Thank you so much. I don't know if Francisco, Jesus, you want to add anything on this or any reflection you have after this discussion.
Yes, yes, Francesca, thank you. Yeah, I can only agree, fully agree with Katarzyna. We have to be realistic in improving working conditions, especially when it comes to mental health of long-term care workers. We have to project a holistic approach. Legislation is essential, of course. We have already the key legislative requirements and obligations in the EU legislation, but this is not sufficient. It's important to implement in practice these legislative principles and complement them by other things, by information, by training, by awareness raising, by sharing good practices, by practical tools, in order to support and to help the managers. You mentioned rightly, Katarina, the importance of putting in place effective measures, starting by the management, with the collaboration and the strong commitment of social partners also, because this is not only a matter for the, let's say, for the authorities or for the management. It's also important, and this is the case in all the occupational safety and health initiatives, to involve all the stakeholders. And maybe I would like to underline in this respect the very important action that is being taken and put forward by EUOSA, the European Agency for Safety and Health at Work in Bilbao, because the colleagues of this agency are carrying out very important initiatives also in the healthcare sector. In particular, there is a very ambitious research project called HealthCare, the Health and Social Care Sector, and OSH, and Occupational Safety and Health. And this research is encompassing all the key aspects, not only the multiple risks in the sector, psychosocial, ergonomic, biological, chemical, etc., but also the contextual factors, the figures, the statistics. By the way, a very interesting report is being to be published in a couple of weeks, probably, by the agency, covering all the, let's say, subsectors in the healthcare, the home care, the long-term care, and also showing some good practices and good experiences that can be shared in order to improve the working conditions. No? So we all know, and you are experts in this field, that when it comes to mental health, awareness is essential, but it is also essential to give practical elements and practical tools and practical inputs to deal with these challenging situations. So, I will stop here, but happy to continue the discussion. Thank you.
Thank you so much. And I'm conscious of time, so I would like maybe to take the liberty to ask a question to Professor Hansen. Elisabeth, you presented the WellCare project, and based on the activities that you have already carried out in the framework of the project and based on your expertise, what do you think could help progress in the area of support for mental health of long-term care workers and informal carers? Thank you.
Thanks very much, Francesca. I think that we do have quite a potentially powerful tool with the EU care strategy. And I think particularly for member states to be able to relate to that in order to support integrated care and to support informal carers. I'm aware that the country action plans are now being made publicly available. And so I think that they're a very good, they're a very important entry point and for us in our respective partner countries to be able to take contact with the national contact person. And so I think that policy environment is very important. And I also think that the partnership between WHO Europe and the European Commission in relation to long-term care is also very important, because here we can see that informal carers' role is recognised, and there are going to be supportive measures for informal carers in terms of access to information and support via an online resource. So I think that is very important as well. So I think due to time, I will leave it at that, but many thanks for your question.
Thank you so much. And I think we are now indeed moving to the closing of this webinar. So I want to thank you, all the speakers and the audience, for this enriching discussion. I think what emerges clearly from today's webinar is the importance of a mental health in all policies approach, with a focus on prevention and on addressing the broader determinants that shape mental health. So in the case of long-term care workers, comprehensive actions are required to address the risk factors and at the source by acting on the working conditions. In the case of informal cares, we have heard that the first thing is to strengthen the provision of formal long-term care so that informal care can be a choice. And then for those who have decided to be informal carers, they need to be supported to avoid that they fall in poverty, that they have to give up paid work, and that they feel socially isolated. So this webinar has also shown the importance of multi-stakeholders approach in addressing mental health problems in our societies. It's really encouraging to see the variety in this virtual room. We have stakeholders from trade unions, from the institution, stakeholders at European level, national level, researchers, NGOs. That's very important, and we at Mental Health Europe believe that together we can ensure that care is valued and that the human rights of all the actors involved are promoted and protected. And then as a reminder, this webinar has taken place in the framework of the Mental Health in All Policy Stakeholders Network on DG Santé Health Policy Platform. And this network is open to every stakeholder who is committed to human rights and to mental health policies and to support shaped around individual needs and preferences. So feel free, if you are not already a member of this network, to join the network. You can receive updates on recent policy developments on mental health and also information about upcoming events on mental health in general. And in the pipeline, we have a webinar on good practices for recovery. So really, I invite you to remain in touch. And as I said before, we will be sending the link for the recording. We will share the presentation vision, and we will also disseminate a short summary of the whole debate today. So I invite you to really engage in the next steps on the mental health in general and on the mental health for this specific target group we have focused on today. And we believe that if we join forces, we can achieve our vision of a Europe where everybody can thrive and nobody is left behind. So I thank you all and I wish you a lovely afternoon. Thank you.
Bye bye. Thank you.